Good evening. In many parts of India, the lighting of a lamp is an ancient symbol of understanding and intellectual thought.
It destroys ignorance and brings peace, health, and well-being.
We would now like to welcome our GHU leadership team to welcome our esteemed guest for the lighting of a lamp.
वक्रतुण्ड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा वक्रतुण्ड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा वक्रतुण्ड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा वक्रतुण्ड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु
Thank you. We welcome everyone to take their seats.
Esteemed guests, friends, and colleagues, namaste, good evening, and welcome to Applying Lessons Learned from COVID-19 for a Stronger Health System, and for commemorating the launch of the Gupta Klinsky India Institute at Johns Hopkins. My name is Dr. Brian Wall, and I am a Delhi-based faculty member in the Department of International Health at the Johns Hopkins Bloomberg School of Public Health.
I am Dr. Vidya Mave. I'm a Pune-based faculty member and a director of our Indo-Johns Hopkins research program in Pune. Today is a special occasion for many reasons. It's the first time in many years that we have seen many of you in the same room. We are incredibly grateful to be with our partners and colleagues today as we commemorate the launch of Gupta Klinsky India Institute at Johns Hopkins University.
It is also World Health Day, a day that marks the beginning of another institution built on the principles of collaboration, cooperation, and solidarity. That is the World Health Organization. We emerged from the last 2 years with a renewed recognition of the importance of health and well-being. The theme of this year's World Health Day is Our Planet, Our Health, with a focus on keeping humans and our planet healthy.
It is in this context of both local and global efforts to tackle COVID-19 in the last 2 years that we now, more than ever, need to focus on protecting and promoting health. In fact, ensuring health is by nature interdisciplinary and collaborative. We are thrilled that today such a diverse group of friends and colleagues and collaborators have joined us to address this incredibly important topic. However, before that, I would like to invite up to the podium Mr. Raj Gupta, co-chair of the Board of Advisors for the Gupta Klinsky India Institute, to provide some opening remarks.
Well, good afternoon, friends, and delighted to have a number of my close family here as well. And on behalf of Johns Hopkins Gupta Klinsky Institute and all my esteemed colleagues and friends here tonight, I would like to welcome you to the launch of Gupta Klinsky Institute in Delhi. In the next few minutes, I'll cover 3 topics. First, share with you some of my background, start of our foundation over the last 10 years, and why Gupta Klinsky India Institute. I grew up in a small towns in Uttar Pradesh like Bareilly, Etawah, Kanpur, and other places, and moved to Mumbai in early 60s. It was my father's wish that I become a mechanical engineer, and I was very fortunate to get admitted to Indian Institute of Technology in Bombay. 5 years at IIT was an opportunity to interact with a very diverse group of classmates. As a young man from UP, I felt I was considered from a backward state, and I strove to adapt and learn to compete with the best of the best. It was then that I began to look outwards and grasp something that became the theme of my career and my life, that communities around the globe are interdependent and need for both collaboration and partnership is necessary to thrive. In 1967, my degree in mechanical engineering opened pathway for me to study operations research at Cornell University in Ithaca, New York. My parents insisted that I get married before I left India, and I had an arranged marriage, and my wife Kamla, partner for 54 years, is here, and that's when we departed in January of 68 for the United States. I was 22 years old, and she was 19. After graduation, I joined Scott Paper Company. Many of you who lived in the United States or traveled know Scott tissues and Scott towels as an operations research analyst in June of 1969, and decided to pursue night school to study finance at Drexel University, where I graduated with MBA in 1971. But Scott Paper had no presence in India, and the wish of my family was to return back to India. And with that theme in mind, I joined a local specialty materials company, Roman Haas. The one trade name you might remember is plexiglass was discovered by Roman Haas, among many, many other things, as a financial analyst in November of 1971, with an idea that they had 2 joint ventures with Modi family, one in Modi Nagar, another one in Mumbai, that this would be my ticket back to India. But as you know, luck plays in different ways. I was very fortunate to spend 39, 40 years at Roman Haas in 13 different assignments, 19 different bosses on 3 different continents, almost 20 years in the US, 10 years in Europe, and 5 years in Asia. And it really was an opportunity for me to adapt and learn to contribute. In 1998, I became CEO of Roman Haas, one of the very first Indian American CEOs of a Fortune 500 company. During my 10 years tenure as CEO of Roman Haas, the company was the second best performer in S&P 500 in terms of value creation. I retired in April 2009 when the company was sold to Dow Chemical for $20 billion cash at the bottom of the market. My time at Roman Haas deepened some of the lessons I had learned here in Mumbai and in India. Global interaction, partnership became essential to adapting lines and to deal with emerging challenges, as did identifying right talent, right focus, and leveraging others' expertise and keeping an eye on broader trends and opportunities for significant impact. When I retired, my wife Kamla and I decided that it was important for us to give back since we have been extremely fortunate. And that is when, in late 2009, we established Ujala Foundation. And of course, you all know the meaning of Ujala. The foundation has maintained 2 focus areas, education and healthcare, and equally divided both towards India, the country we were born, and contributed to our education and our culture, and also United States that adapted us and made us successful. Along the way, over the years, we have contributed to a professorship at Johns Hopkins. We launched Governance Institute at Drexel University and a scholarship for Indian students coming to Cornell to study biomedical engineering, as well as business at Drexel University, and some modest contribution to the civic activities both in India and in the United States. At the time I joined, we started the foundation. I was also fortunate in my retirement to join a private equity firm, New Mountain Capital, which was founded by Steve Klinsky in 1998. The reason I mentioned because Steve has never been to India, but his generosity has been just phenomenal, as you can see the launch of this institute. Steve Klinsky is a pioneer in private equity business, and I joined his firm, New Mountain Capital, in 2010. And one among many projects that I was involved with was to buy an orphan asset called J.T. Baker from a big company and build it into a Fortune 500 company, Avantor today. What an adventure it has been. And it's a company that supplies, and two of my colleagues from that operations are right here, Devori and Sushil Mehta. But in addition to Steve's professional achievements, I have grown to appreciate his unique orientation towards the concept of making an impact. He possesses a singular talent for addressing massive challenges by assembling right players and carefully defining an achievable scope with exponentially greater output. Scalable, meaningful impact is what Steve and his wife Maureen, Kamla and I see in Gupta Klinsky India Institute. A vision to address some of the world's greatest problems by developing solutions and innovating right here in my home country. As you know very well, that individuals of Indian origin work around the world in research, and number in India of that talent is growing rapidly as well. Johns Hopkins, as you will hear more, has been partnering with Indian institutions for nearly a century and already has contributed to discoveries and insights that have changed the world. From the earliest work on oral hydration therapy, which has saved millions of children in the developing countries, as well as dealing with primary care and healthcare systems globally. Our earnest hope is that this undertaking, the Johns Hopkins Gupta Klinsky Institute, will bring the best minds, the right minds together to find ways to improve lives everywhere by thinking big, by focusing, and by scaling. Some of those minds are sitting right here in this room. I would ask you to dream with us. Do not restrain your ambition. Only with your help and your perspective can we maximize what we provide to others. You have partners at Johns Hopkins committed to India and looking for ways not only to collaborate, but also to learn. I hope you'll join us in this work. Thank you very much for this opportunity.
Thank you, Mr. Gupta, for sharing your inspiring story, for your generosity, and for your call to action. We now have a recorded message from Mr. Stephen Klinsky, member of the Board of Advisors for the Gupta Klinsky India Institute at Johns Hopkins, and Maureen Sherry.
Maureen and I and our family are thrilled to be supporting the Johns Hopkins India Institute because, we're trying to help people all over the world, and India is obviously the largest democracy in the world, a major population center, a great place to develop new ideas. So we're thrilled to support Johns Hopkins in India as a way to help India and everyone else.
Johns Hopkins has just a phenomenal public health effort. There's nothing like this pandemic to really drive home for all of us how interconnected and global the world is. So having the great minds of Johns Hopkins coming together, putting effort into public health in such a dynamic way is something that really spoke to us. We had the privilege during COVID of being able to collect our family to go to a place that had space, that had fresh air, that had where we all were just fine. Did this in this particular time in life drive home for us how many people did not have that privilege? It did. And certainly we saw Johns Hopkins as answering the call of that same mission that we were feeling.
It's a great opportunity. I've known Raj Gupta for years and have tremendous respect for him and Kamla and his family. He was working with Johns Hopkins on this project, told us about it, and we said Raj would love to be a part of it. It's such a great idea to be part of Johns Hopkins and the Gupta family to do something so important. We were thrilled to join in and support the effort. You know, it's clear now that public health is one of the most important issues that the planet faces. India is one of the most important places to address that issue. Johns Hopkins is, you know, perhaps the best public health institution in the world. So it seems like the right thing to do at the right time, and our family is pleased to support it.
So on behalf of all of us at Johns Hopkins, I want to thank Raj Gupta, Kamla Gupta, Stephen Klinsky, and Maureen Sherry. We are grateful that you have entrusted Johns Hopkins University through the Gupta-Klinsky Indian Institution with an incredibly important mission: to work with and support partners in India to improve society through research, education, policy, and practice. Thank you again. We now have a short video that we would like to share that provides just a share of some of the activities that we have undertaken with our many partners in India in recent years.
आपने टीका लगवाया ना?
काय हो? टीका लगवाया ना? हाँ?
It's always inspiring to be reminded of the fantastic work of our faculty, staff, and students in India. But more important, none of this could have been possible without the many partnerships that we have throughout the country. So thank you. And we look forward to continuing this important work in the years to come. I would now like to invite Dr. Sunil Kumar, Provost and Senior Vice President of Academic Affairs of the Johns Hopkins University, to the podium to provide an opening address.
Good evening, and let me begin by thanking you all for attending our event today, especially our alumni. There is no greater satisfaction for a university than to see its alumni do so well. So thank you for joining us today. Thanks to our current and our future partners, our leaders from government and industry who are here today. Thank you. Thanks also to the very dedicated team of Hopkins faculty and staff who are here today. Thanks for all that you do. And finally, thanks to Kamla and Raj and Maureen and Steve for their generosity that allows us to build on what, as the video pointed out, over 130 odd researchers are already working and have been doing so for decades in India. So I'd like to do three things in my brief remarks. I'm standing between you and our keynote speaker, and believe me, my value add as the head bureaucrat here is somewhat limited. And so I'd like to do three things. First is to talk about our approach, the Hopkins approach, and how it differs from some of our peer US institutions, to talk about our areas of emphasis, and to lay out a vision for success. Our approach, the Hopkins approach, has three salient characteristics. First, respectful, equal, and complementary partnerships with our Indian partners. We don't believe in parachuting in with answers when we don't even know what questions to ask. We partner with government agencies, with educational institutions, with private enterprise, and the nonprofit sector. The second is an emphasis on actual impact. We study and we teach like our peers, but we're not afraid to tackle the doing part. In fact, the motto of Johns Hopkins is bringing the benefits of the discovery to the world. This demands that we do not stop at research or discovery, but go on to find ways to have real impact. This, of course, forces us to build partnerships with the government, with the private sector, and with nonprofit organizations. Third, we know that we have a lot to learn in India, and what we learn in India will help us back in the US and around the world. The talent and capabilities of our Indian partners are particularly valuable in this regard. Rather than talk in vague generalities, why don't I give you an example that's relevant to today's topic? In UP, Hopkins is working with the State Directorate of Health and Family Welfare on health systems development. They have jointly developed competency analysis, and that analysis is now being incorporated in the National Mission Karma Yogi framework, in the FRAC framework, which is frameworks of roles, activities, and competencies. And we are hoping that what we learned will help us back in the US, and what Mission Karma Yogi will achieve will, of course, have substantial impact in India. Let me now turn to our areas of emphasis. In picking these areas, we have evaluated our own and the stated priorities of India's leadership, the strength of current and future partnerships in India, and the potential impact of these activities. So as you would imagine, with a name like Johns Hopkins, the broad area of medicine and public health is, of course, one of the areas of emphasis. But within this, health system development, maternal and child health, and infectious diseases are particularly important areas of emphasis for us. The second area of emphasis is technology and data science, particularly where it intersects health, such as precision medicine and biomedical engineering. And finally, the third area of emphasis for us is energy and environment. All these areas of emphasis require more than one discipline to come together to have impact. Johns Hopkins' contribution to COVID-19 was our dashboard, which was quite visible all around the world. It may amuse you to know that it was not built by our public health people. The dashboard was built by a civil engineering group who were studying the impact of transportation systems on the movement of pathogens. And they ended up building the COVID-19 map. And what this emphasizes for us is that we need to bring all disciplines, and in our case, 7 different schools to bear on the projects we want to tackle in India, from engineering to public health to medicine, nursing, international studies, etc. And of course, our dashboard pales in comparison to the achievements of this country in tackling the COVID-19 pandemic. And therefore, there's a lot for us to learn here as well. So finally, let me turn to our vision for success. We will be successful if we will have had a substantial impact through partnerships on research, education, and practice, not only in India, but in the world at large by what we have learned in India. So thank you for joining us as we continue on this journey, and thank you to the Guptas and the Klinskys, because by funding this umbrella institute that will support our researchers on the ground, we will be able to achieve this vision of success. So thank you all again. And with that, let me turn it back to the MC to introduce our distinguished keynote speaker, Dr. Kant.
Thank you, Provost Kumar. I would now like to invite Shri Amitabh Kant, an Indian Administrative Service Officer, Chief Executive Officer of NITI Aayog, to provide the keynote address.
Mr. Raj and Mrs. Kamla Gupta, let me also welcome Stephen Klinsky and Maureen Sherry, despite the fact it's in absentia, but their contribution is highly appreciated. Dr. Sunil Kumar, the Provost of Johns Hopkins University, our distinguished panelists for the day, Dr. Balram Bhargava, Dr. Amita Gupta, Dr. Gagandeep Kang, Dr. Srinath Reddy, Dr. Naresh Trehan, all of whom have so significantly contributed to India's public health care, and particularly during the COVID-19 pandemic. Let me at the outset thank the Johns Hopkins University for its great effort in developing this Gupta-Klinsky India Institute. Johns Hopkins, to my mind, is the ultimate in public health, and there could have been nobody better than Johns Hopkins. This is a great effort, and on behalf of Government of India and NITI Aayog, I take this opportunity of thanking Johns Hopkins for collaborating with us in building up a unique institute in India. It was really fascinating to hear Mr. Raj Gupta on his journey from the small districts of Uttar Pradesh to United States and to heading a Fortune 500 company, and go on to do creative things and wanting to give back to the country in such a unique manner. So both to Raj and Kamla Gupta, thank you very much for giving back to the country and contributing in such a unique manner. I would also take this opportunity of thanking Stephen Klinsky and Maureen Sherry for partnering both of you in building this unique institute. This John Hopkins Gupta Klinsky Institute is, to my mind, a felt need. It'll fill a huge vacuum in India. Public health is critical for India. And we in government and we in NITI Aayog in particular will be delighted to work in partnership with this institute. Public health is critical in India because I've been a long-term believer that India needs to grow at rapid pace of 8 to 9% per annum over a 3-decade period, year after year, to be able to lift a very young population above the poverty line. This growth on a sustained basis over a long period cannot be achieved without a huge improvement in our social indicators. My own experience of Kerala for a long period has been that its improvement in health outcomes, in learning outcomes, and improving nutritional standards lays the foundation for a sustained growth over a long period. Unless and until we don't improve these indicators, merely carrying reforms in the field of economy or introducing foreign direct investment or opening up economies for greater investments will not sustain for a long period. Actually, India has grown at high rates of 8 to 9% for relatively short periods of 5 to 6 years after the post-91 reforms. The challenge is to sustain this over a 3-decade period. And that really requires a huge amount of effort to improve health outcomes, learning outcomes very radically, and to my mind, nutrition, of course, is very, very critical. Our own experience of COVID-19 and the catastrophic human, social, and economic toll of the pandemic has demonstrated that protecting health is critical for economic security. Just as economic development and health developments are inextricably linked, so too economic resilience depends on very resilient health systems. It is not possible that without good, strong public health systems, economy can grow and flourish. Quite often we in government fall into the cycle of panic and then forgetting. Frequently, this has been observed in past pandemics, that we just forget once the pandemic is over. And therefore, increased investment in emergency preparedness and response has all too often has been followed by rapid disinvestment and actual neglect, which weaken health systems and undermine economic resilience. The reforms, therefore, must integrate health emergency preparedness and response systems into universal health coverage efforts. And these must be based on primary health care and essential public health function approaches with reorientation of investment and resources towards primary health care. And I'm a great believer in primary health care, and these reforms will actually help build all hazards health emergency preparedness and resilient health systems. They will actually, in the long run, generate a very substantial return on investment in terms of healthier populations, economic resilience, and equitable social development. So we in India need to invest in whole of society governance with meaningful engagement with communities and civil societies, the private sector, and that should be the real role of the government. Universal health coverage and health security are actually interdependent, and their complementary health goals. And a strong and resilient health system provides the foundation for both. Health systems actually they are built on a multi-sectoral, whole of society approach and are key to effective management of all types of health hazards. They enable existing capacities to address increased health needs and underlying risks. They ensure sustained delivery of high quality, safe essential health services, even during pandemic and emergencies, and build back better through the recovery period, making use of the various lessons that we have learned during the pandemic. But this would require a very proactive, very system-wide integration of universal health coverage and health security efforts at both the primary, the subnational, the national, and the community level. Over the past decade, we in India have actually, especially during the last 5-6 years, have implemented a wide range of reforms in the health sector to expedite the progress towards universal health coverage. The government has actually shown a commitment to achieving sustainable development goals and providing universal health coverage for all its citizens by 2030. In 2018, the government launched the Ayushman Bharat Yojana, which actually adopts a continuum of care approach comprising of two interrelated components. It focuses on 150,000 Ayushman Bharat Health and Wellness Centers at the grassroots level, catering to preventive primary care. And this, to my mind, was the more critical aspect of it. And Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which was actually driven by two of my colleagues who are here, Indu Bhushan and Dinesh Arora, in its initial period. And this is the world's largest publicly funded health insurance scheme. This covers 500 million Indians, which is more than the population of USA, Europe, and Mexico put together. It is totally cashless and paperless, and you can be from Bareilly in Uttar Pradesh, you can be traveling to Tamil Nadu, you can carry your health insurance with you. We are also, as I mentioned, transforming the 150,000 sub-centers and primary health centers into health and wellness centers. And our aim is to provide comprehensive and quality primary care. These health and wellness centers, which almost 81,000 are functional, will provide a broader range of healthcare through the essential package of services, including screening and treatment for non-communicable diseases and chronic communicable diseases like tuberculosis. The PMJAY is also path-breaking in many ways. As I said, it's cashless and paperless, access to services for the beneficiary at public and private impaneled hospitals for more than 1,500 predefined health benefit packages. More than 25,000 hospitals have been impaneled with over 26 million hospital admissions and over 130 million PMJAY cards generated within 3 years of scheme implementation. The scheme has led to increased access to health services and medication, timely treatments, improvements in health outcomes, standards of healthcare services, and patient satisfaction. It has also contributed in very significantly reducing out-of-pocket expenses. One of the key initiatives which we have taken in government is to now launch the Ayushman Bharat Digital Mission. And this aims to leverage information technology to strengthen the accessibility and equity of health services, including a continuum of care through a citizen-centric approach. Many of you are aware of the platform approach that we have taken in the JAM Trinity, Over 1 million Indians have biometric. They have their bank accounts. They have their mobile telephony. Many of you are aware of the Unified Payment Interface, which has enabled Indians to transact through their mobile telephones, which has enabled cash flow lending, which has enabled people to do personalized investments, etc., all through mobile telephony, all digital. And this has been a technological leapfrogging of India in many ways. And therefore, the digital mission aims to leverage information technology to strengthen the accessibility and equity of health services, including a continuum of care through a very citizen-centric approach. This would focus on National Health ID to allow seamless flow of health information with patient consent. Healthcare professional registry with a comprehensive repository of healthcare workforce in the country, and a health facility registry including details of hospitals, clinics, diagnostic labs and imaging centers, pharmacies, and other health service providers, and electronic health records with patients' longitudinal medical history. This would be transformational in many, many ways, much like we did the COVID, which was totally digital, and which enabled India was the only country in the world which had a vaccination drive covering a vast segment of its population, over 1 billion, through a digital movement, through a digital app, COVID. No other country in the world could do this. I was recently in the United States, and everything was based on paper. And in sharp contrast, India's vaccination drive was entirely digital. And therefore, creating a national digital health ecosystem will support the country's progress towards a universal healthcare in an efficient, accessible, inclusive, affordable, timely, and safe manner. We are also pushing for the improvement of infrastructure in rural areas through the Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, which is a pan-India health infrastructure strengthening scheme. This is in addition to the National Health Mission and a part of the Ayushman Bharat initiative, and therefore we'll be augmenting health facilities for treatment, establishing integrated public health labs for diagnosis of diseases, and expanding the existing research institutions that study pandemics at the grassroots level. India's ongoing efforts make complementary investments to strengthen primary health care and reduce barriers to hospitalization totally in line with globally recommended best practices on health systems, strengthening for universal health care. While the country's health sector has made significant progress, it has to continue its journey towards universal health care and address critical challenges. And there are many, many challenges for improved health sector resilience. And I'm sure that in the days to come, the Gupta Klinsky Indian Institutes of the Johns Hopkins University will play a very critical role in meeting all the challenges that we'll be confronted with. And we in Government of India will continue to work in very close, very constructive, and a positive partnership with the Johns Hopkins Gupta Klinsky India Institute. Let me take the opportunity of thanking Johns Hopkins University and congratulating Raj and Kamla Gupta and Stephen Klinsky and Maureen for their immense contribution towards India. Thank you very much, ladies.
Thank you, Mr. Kant. We are inspired by the work of NITI Aayog, and we thank you for your able leadership. Specifically in the areas of pandemic preparedness and universal health coverage, the areas in which you mentioned, the government is working in great stride to address through efforts like Ayushman Bharat. And we're excited and honored to work with the government to support these efforts. I would now like to welcome to the stage our esteemed panelists. Each of our panelists is highly accomplished. Describing each of their achievements would take the entire evening. So we have included their biographies in the brochures for the event today. I would now like to invite to the stage Dr. Balram Bhargava, Secretary, Department Health Research, Ministry of Health and Family Welfare, and Director General, Indian Council of Medical Research. Dr. Srinath Reddy, President, Public Health Foundation of India. Dr. Amita Gupta, Chief of the Division of Infectious Diseases at the Johns Hopkins School of Medicine and Faculty Co-Chair of the Gupta Klinsky India Institute. Dr. Gagandeep Kang, Professor at Christian Medical College, Vellore, and Director of the Wellcome Trust Research Laboratory. And Dr. Naresh Trehan, Founder, Chairman, and Managing Director of Medanta. And our moderator for the discussion today, Naghma Sahar, Senior Anchor and Editor at NDTV.
Thank you. Hi. Thank you. Any of you need the mic? I have the lapel anyways. Hello and a very warm welcome to all of you. It's really, really nice to be together offline in this hall after being online for such a long time. So a very warm welcome to everyone, and we look forward to having a very interesting and engaging conversation today. You know, even though I must say in the beginning that the pandemic is not really over, it's far from over as new strains emerge, and as China is still reeling under the repercussions of a very severe wave of pandemic and very stringent lockdown. But we're all at this moment when we look back, when we want to look back and see what are the lessons that we have learned from this pandemic. And perhaps we shall look at the way the events unfolded, and we would also like to see what were our triumphs, what were our disasters, what are the lessons that we have learned, how can we improve our existing health system, because world over we saw that when the first wave struck, the health systems were struggling or rather collapsing under the weight of the pandemic. But the second time, at least here in India, we saw things were much better. So, you know, I want to borrow a line from Dr. Bhargava's book when he says that all of us are really hopeful and honestly wishing that we look at the pandemic in the rear view mirror. But, you know, till we do that, we just want to look back and see how have we done, how are we better prepared. And I want to welcome all our esteemed panelists, and I would like to begin with you, Dr. Reddy, and start by asking that in terms of public health system, we know that it plays a very, very important role, especially in times of these health emergencies. So where are we in terms of a public health system, and, you know, looking at the experience of the pandemic, what more can be done?
Public health systems.
Do you want to borrow this mic?
Seems to be working now.
Right.
Thank you. Our public health systems could certainly do with a much greater improvement. Certainly, the pandemic has given us the caution that we need to improve our public health systems as well as our primary health care systems, which are strongly interlinked in any case, both from the point of view of preventing disease, early detection, and early response to any pandemic situation. I think primary healthcare services are absolutely pivotal. Indeed, if you're looking at primary care, for early detection of suspected cases based on symptom-based syndromic surveillance by frontline health workers, or based on history of exposure or on travel to epidemic intense areas, I think the early detection of cases is going to be absolutely important. Then prompt testing is going to be important, and sometimes repeated testing may be necessary because all the tests are not necessarily the most sensitive at each period of the infection. Then home or facility-based isolation, contact tracing, counseling on quarantining protocols, home care which is supported and supervised for mild to moderate illness, then triage for referral to the hospitals, telemedicine connect for consultations to the primary health care. All of these are essentially located in primary health care settings. Then, if you're looking at vaccination, for example, that again is a primary health care function. Then, even when people are returning from hospital, if they've been hospitalized, post-hospitalization care, care of long COVID, all of these are essentially primary health care functions. And these are essentially public health functions. Then, health education on COVID-appropriate behavior, on building up vaccine confidence, countering fear and stigma, which can be threats in the case of an efficient pandemic response. All of these should be ideally handled by the frontline health workers in the primary health care. Even when it comes to some of the elements of multisectoral action, like for example, where you have to collaborate with other departments, whether it is sewage surveillance in urban areas, or early detection of unexpected outbreaks in farm animals in rural areas, it is the primary healthcare workforce that is most close to the scene of action and which can activate other sectors as well. So I believe in all of these areas we need to build up our competence. But in the whole area of public health, which is beyond primary healthcare as well, we know that right from the point of view of building up our capacity for testing, including genomic surveillance, and then ensuring that we have the appropriate methods of containment of the pandemic spread and ensuring that services are provided at different levels of care when needed, all of that is going to be an absolutely important function of public health.
But during these times, where were we lacking? And if you look back at the primary health system, how you mentioned that it is really important. What are the various functions of the primary health system? How essential is it to strengthen it in terms of an emergency situation like this, like the one that we saw during the pandemic? What's the role that it plays, really?
Unfortunately, what happened in the past is that while rural primary health services at least existed as a design, they were functioning, though not fully resourced to the highest level of requirement, either in terms of adequate number and skilled healthcare workers all across the country. And financially also, they were not adequately resourced. At least there was a rural primary healthcare system. But urban primary healthcare was not even really a design feature in many places. A few municipalities did have. And it is through the urban areas that the virus first entered. It was through the international airports. And our ability to first detect and contain the spread in urban areas was actually a problematic area of relative weakness. And even contact tracing. Contact tracing is not a function of policemen. It is a function of trained public health workers. And that is where we ought to have actually invested much more. Sure, you have to use all the resources at your command. But if you have a multi-skilled, multi-layered public health workforce functioning, then you will have an efficient, equitable, and empathetic health system which you can fall back upon to build a swift, strong surge response when you are challenged with a public health emergency.
Absolutely. So since we are discussing here the lessons and how can we apply the lessons learned from COVID for a stronger health system, I would like to actually have all my panelists a small comment on the basic question that given where we are in the pandemic now, Dr. Balram, what should we do to strengthen the public health system, and how important is that to ensure that it is a more resilient health system? We saw during the pandemic how the world was unprepared. So what do we do? What are your comments? What are your views on that so that it's more resilient?
I think the point that Srinath has mentioned about investing more in the primary health systems, whether it be rural or more so urban, I would just say one word: training, training, training. The more that happens, the more we are going to get. And it has to be taken to the lower levels, and that is important, and awareness.
So you are insisting on more training, especially the public health system. What are your views on that, Dr. Amita Gupta?
Well, absolutely. I think it's a multifaceted and multi-pronged solution that's needed. You know, I think the world over, and in my sort of hometown of Baltimore, we have many lessons learned. We divested in the American health system from the public health system, and we paid a cost. We saw the devastation of COVID. We had vaccine hesitancy. We didn't have a public health workforce that could go out into the community. We didn't have trusting communities. So these lessons are global. And I think the point is we need to invest for the long haul. We need to have training, whether it be here, there. We also need public-private partnerships. It's no one group has all the solutions. We need government, we need private sector, we need civil society to come together and to really be prepared to provide primary health care, to be informed about public health, and to be ready for any challenge, whether it be a chronic disease, vaccination, a cardiovascular bypass that might be needed. I mean, we need the whole gamut. And it's going to take a lot of investment. And we're learning, and I think India and the United States certainly has a long way to go in making things better in our public health workforce. But I think we are encouraged by what we are seeing from lessons learned.
Yeah. Let me put that question to you, Dr. Gagandeep Kang. You know, in terms of lessons learned or in terms of the response to COVID in India, a lesson that we can build upon towards a more, resilient health system.
So maybe I'd like to turn things around a little bit and say that there are examples in India of things that work brilliantly. You know, if you look at a rural tribal district in Maharashtra like Nandurbar, they had no problem with oxygen during the Delta wave because the district collector was proactive. You have the example of what happened in Mumbai in a distributed mechanism for managing patients during the pandemic, referral systems. So there are examples of many things that worked well in India across the pandemic. But the examples can be turned the other way around to say there was huge heterogeneity in that these were examples. This was not a functional system across the board. So we know it can be done, and the point in lessons is to take from those examples what can be built into systems.
Mm-hmm. Dr. Trehan, your views on that, given where we are in the pandemic now, what should we do to strengthen the public health system to meet these kind of emergencies and the ongoing health challenges?
So fundamentally, the world got a big shock. Nobody expected this kind of thing to happen. And if you look at, one of the biggest criticism was the paucity of oxygen supplies. Mm-hmm. So our daily requirement for oxygen across the board is 2,000 tons a day. It exceeded 10,000 tons a day. No country could ever be prepared for a catastrophe like that. But I must say that the systems came together. Everybody pitched in. When you talk about paucity of public health workers, all this other stuff, it is true that India has underinvested in health. Our budgets don't reflect that. We are way behind all the indicators in the world, and we need to actually do that progressively. Why it hasn't happened, I mean, we request it every year, but whatever the priorities of the government are, but slowly we are inching towards that, because there are many schemes that are on the ground, and the biggest one, when we talk about public health, is the Ayushmans. They're not the Ayushman, the Asha worker on the ground. We have more than 1 million Asha workers. For every 1,000 individuals in a village, there is one Asha worker. The Asha worker today is totally undertrained and underemployed, because they are only ushering patients from people to the wellness center or something like that, and taking some census and stuff. But they could be trained. We have, I had the Health Sector Skill Council, and we have developed a 10-module program for upgrading the skills of the Asha worker who's already on the ground, to convert them into a sort of a passive worker to a frontline health worker. That's a big resource which is underutilized. So that's one, we start from the ground. Then as mentioned by Mr. Kant about the wellness center, I think if we link these chains together, from the ASHA worker to the wellness center to the civil hospital to then the specialty hospital, it'll take the chaos out of the system today. Because what happens is people don't realize how sick they are not triaged properly, they run in panic. I mean, you look at All India Institute, where Dr. Balram Bhargava comes from. I mean, everybody rushes for a cough and cold to All India Institute in Delhi. Now, that's because the systems are not in place, and I think what COVID brought to us was the fact that, look, when we linked ourselves together, including the government facilities and the private facilities, which were totally separate in different silos, till this challenge happened, that there was a lot of capacity and expertise available on both sides, which was not linked to each other and not performing that well on their own. But when this whole catastrophe occurred, there was huge cooperation, appreciation of each other, and whatever was lacking in our public health force was made up hugely by the doctors. I must say the doctors did extremely well, the healthcare workers did extremely well, fearless for their lives. I mean, there are people who are away from their families for 2 weeks at a time. They couldn't go home because they were exposed. So to take that into a perspective, we proved that 1.5 billion people could be taken care of with one of the lowest mortality in the world. Yeah. And the second thing it brought out was that if you were healthy, your chances of survival and not getting into serious trouble were much better than if you had comorbidities. Mm-hmm. So if even now people don't understand the consequence of ill health, of diabetes, of smoking, of obesity, which is such a big thing, of getting, taking other infections casually, then we have a serious problem. But from the government's point of view today, as I understand, because I was on the Supreme Court task force, that we have a war room in the Ministry of Health, which is real-time collecting information from all the districts. Because the basic thing is, if we can predict and prevent, it'll be much better than treat and repent.
So one thing, yes.
So that's where we are at. I'm as you can see, I have a huge optimism about our future.
Yes.
I'm,
especially about
it's fashionable to criticize. But we know the inside workings of the government and the private sector. And it was remarkable how they came together. Yes, there was misery on the ground. Yes, in the first wave, we misunderstood how to take care of, but the Prime Minister had said that I expect all the industries, all the construction sites to take care of their employees.
Exactly.
Which they did for the 3 weeks, and then they let them go because we don't have the resources.
So we will look at how the government and the private sector can or has learned from this to come together and work in tandem. But I know Dr. Srinath Reddy has another engagement. Before you go, I would like to pose a very specific question to you, Dr. Reddy, that COVID-19 has been called a syndemic, a convergence of infectious disease and NCDs. And India, I believe, has a growing incidence of NCDs at the time when some infectious diseases are reducing and some remaining endemic. So how do we relook at our approach to health in general?
Clearly, we need a system which is capable of providing comprehensive health care to every individual across the entire course of life, during which you may have some infections, but you will surely acquire some risk factors of non-communicable diseases. You must try and prevent them, detect them, control them, and if the people do develop non-communicable diseases, you must try and care for them early on before they develop complications. In terms of COVID, we have seen how the comorbidities, which actually landed people in severe illness, hospitals, intensive care, or even led to death, were mostly non-communicable diseases. Partly because many of their organs had already been damaged. There was ongoing inflammation on which the viral disease superadded. And therefore, we recognize that we do need to control these. Even when you looked at the priority groups for vaccination, who should we prioritize first for giving vaccines? Then you said we want the people who are having comorbidities, elderly, who also most likely have a lot of non-communicable diseases. But if our health system has not recognized people with hypertension, diabetes, other chronic diseases, then they're not only missed for routine care, they're even missed for the vaccination prioritization. So it is absolutely important that our primary healthcare system, again, is strong enough so that we don't have these missed opportunities for detecting people early, taking care of them, and ensuring that they do not develop the kind of morbidity which predisposes them to very serious illness when a virus strikes. So these are important elements that we must look at, and no health system can actually proceed with a tunnel vision. We must have a health system capable of addressing both infectious diseases as well as non-communicable diseases, depending upon which is actually much more prevalent at any period in time. But invariably, we now know that they will be there in every society with some upsurges here and there of infectious diseases, but non-communicable diseases are actually going to be the dominant theme for the future. So we need to take care of both of them.
Absolutely, in an integrated approach and a wider perspective. You cannot have a tunnel vision. Thank you so much for that. Dr. Balram, Bhargava, I would like to understand from you, ICMR is the apex government body in terms of health research in India. So what's your vision on the R&D landscape of India in coming years, and how can international academic institutions like the Johns Hopkins, contribute towards that?
See, first of all, I want to tell you that the greatest thing that we learned from the pandemic as a nation was that we got self-confidence. And I think self-confidence cannot be purchased, and we got it this time. That we as a nation, whether it be scientists, whether it be doctors, whether it be ASHA workers, whether it be healthcare workers, can deliver. So, and with the emerging new world order, India is going to become very, very relevant, and great universities like Johns Hopkins University, which is the mecca of public health for the world, I think working with them and sharing a common vision, particularly for the global south and for underprivileged areas and countries, Africa and Southeast Asia, will be very important. That is my first point. The second point is that when we work together as two nations, North and South, we need to utilize innovation, and all these innovations have to be frugal. So cost will remain a very important parameter for whatever we are going to do together, as working with Johns Hopkins or with India or with ICMR. So that is hugely important. So cost will remain the most important driver. And therefore, as a generation and as a nation, we have been sensitive to cost, but as gradually we become global citizens, we lose that frugal mindset. We lose out on our innovative, cost-effective thinking. So that has to be preserved in some which way.
Sure. Now the question that Dr. Trehan was mentioning, the point about the cooperation and how the private and the public sector partnered during these times, because the public sector could not alone manage the kind of pandemic that we were witnessing, and health systems were collapsing the world over. So what are the lessons learned in terms of partnership between the government and the private sector?
I think that is a classic example is the public-private partnership of the development of the Covaxin, which has been a game changer in the nation, and is also again I bring back the same point, given a lot of self-confidence to our scientists and our doctors as well. So I think the role of the government sector alone is not going to work. The government's role is to handhold the private sector in some which way so that they could be more and more productive. government's role is not the role of the private sector. So that is most important to remember. And all the three players, which is commonly used in Hindi parlance, Sarkar, Samaj and Bazaar, all three have to work together.
Sarkar, Samaj and Bazaar. Of course, that's very important, the Bazaar angle to it. Dr. Gagandeep Kang, I would like to ask you, you're a leading epidemiologist and virologist of the country. What are the potential imminent challenges that the country faces in the event of another pandemic? Are we better prepared now? And if not, then how can we best prepare?
So I think if we think about future pandemics and what needs to be done about preparedness, I would rank order interventions that are needed. And the first one is sustained commitment. We saw commitment, but to sustain commitment is a whole different ballgame. And if we do not maintain a commitment to continuing to build preparedness, we will be in the same boat we were in at the start of this pandemic. The second thing that I will say is really important is data systems that talk to each other. One of the things that we saw was that many states had good data, but that data did not reach the center. Many central organizations had data, but that data could not be integrated with other data sources. I will use as an example a question. Does any vaccine that we have really prevent hospitalization across all parts of the country? That data is not currently publicly available.
Sure.
Data on deaths is available, but not on hospitalizations. So I think making sure data systems are functional is important. Dr. Bhargava referred to training. I will just say that you can build the ICUs, but you can't build the critical care physicians in a day. So thinking about building up the people that we need at different levels of care and planning for that is absolutely critical, not just for the health system, but also for preparedness for the pandemic. The next area I think is important is reach. To be able to reach underserved communities with the services that they need. You can't expect people to come to the health system in all situations. You need for the health system to identify them and be able to reach them with any intervention, whether that is testing or that is provision of care or provision of vaccination. We've done a reasonable job for some of these things in some of the places, but it does require a stronger systemic approach.
Sure. Dr. Bhargava, would you like to comment on that? Where were we? How did we fare in terms of reaching those who needed the service? Of course, the first year, there was much to be done. The second year, the second wave, rather. Last year, how did we really improve upon what we learned from the previous year?
I think reaching to underserved areas, reaching to tribal populations, reaching to geographies, we did well, but still a lot needs to be done. I'll just give you an example. I think India was the only country in the world where we were able to deliver vaccines by drones. Nagaland, Manipur, we sent vaccines by drones. I mean, it was heart-rending for me to see how vaccines were sent from the capital of Nagaland to the Lokmat Lake, which is the largest freshwater lake in Asia. And there is an island there. And on that island, there is a primary health center. And vaccines were delivered in a matter of 15 minutes, which would have taken about 7-8 hours of drive, 3-4 hours of boat trip, and about 1 hour of walk on that island. So that is, I think, something which we need to innovate. And these were vaccines which were 2 to 8 degrees. Minus 70 would not have been practical for that. So reaching vaccines and getting them to the underserved areas. So we were constantly learning, we were constantly innovating, and I think lots has to still, it's endless possibilities. Country 4,000 kilometers north to south, 4,000 kilometers east to west. So I think there's a lot of possibilities.
The challenge is to take the healthcare system to those in those remote
exactly. And I
remote
think
areas.
that is also the vision of the leadership, that healthcare, rather than people coming to the health infrastructure, healthcare should be delivered at the doorstep. And there are examples of that which we've tried to work out, but again, there's islands in the ocean, and we have got to expand that.
Dr. Amita Gupta, today we are talking and having this panel discussion on the occasion of the World Health Day, and the focus is One Health. So what are your thinkings on a very comprehensive health system which focuses on the theme of One Health?
Yeah, great question. And I think we heard a lot of the points about sustained commitment, skilled workforce, having quality data, whether you need data from the community, you need data from the labs, you need data from the different points, you need to really be able to integrate. And we know from One Health, understanding how COVID comes from animal populations, food systems, what the environment has, as well as what the human hosts have. And so One Health is a great way to get at understanding an ecosystem that takes many different pieces of society and has us understand, human behavior, the pathogen, the host, and the like. It's not just one, and the environment. It's really the tripartite of One Health, and that's the mission that we're trying to invest in to prevent the next pandemic. We need to be able to invest in science and have a cadre that's well trained. The vaccine, we give a lot of credit that it was so rapidly developed, but that was investment of decades into science of coronaviruses, studying prior pandemics, being ready to have the workforce to think about how do we understand the virus and the human response to it. It's not like we just took the virus, the sequence, and 100 days later came up with a vaccine. There were students studying for decades with great mentorship and in great labs. And so I'm hoping, I was very impressed in this trip that I had. I see India a place for frugal innovation, for the best scientists, for really creating the solution for the world. And it will be in vaccines, it will be in therapeutics, it will be in novel ways to frugally innovate behavioral interventions. I know that this is going to be the place to partner, and we're, have so many amazing lessons we've learned to date. And I think that, when I look at a place like the Serum Institute or Bharat Biotech, billions of doses have been made in short order and ramped up to provide the world a resource that was needed.
Sure. Now the question I have for you, during this pandemic, we saw that many other serious ailments were actually neglected because we were so bogged down by looking after or only focusing on dealing with COVID-19. You are a TB expert. So the COVID-19 posed so many challenges to fight against other serious ailments, other infectious diseases. How can we regain momentum in terms of, for example, fight against TB and elimination of it by 2030?
Yeah, I think the world over has realized the impact of COVID, and we're only beginning to see, the sequelae, and we're going to live for many years to come. The impact of people not coming to care, being really scared to get care, to get tested. And that's not just India, that's in much of the world where it was truly all health systems got disrupted. So for tuberculosis, for example, we know that there was a dramatic decline here and in many parts of the world. And we expect to see a resurgence in cases because people have been delayed in getting a diagnosis and into treatment. Similarly, we know people's diabetes, their smoking cessation, all of the counseling that we normally would do if they were in primary health care has all been disrupted. So we have to do catch up. We have to catch up on immunizations. So we're going to have to do a lot of work over the next steps, and we're going to need investment, and we're going to need innovative, frugal solutions by which to do the work that's ahead of us.
The focus had just shifted to COVID-19, and many areas got neglected, actually. Yes. So a lot more work needs to be done there. Dr. Trehan, we've been talking about private-public partnership, and you have already spoken a bit about it, but I would like you to hear from you a little more detail about the role that the private sector, non-pharma included, discovered for itself during the pandemic, and which will be relevant in strengthening the health system here in India.
Well, you know, it started with the first people who were detected as a group were the 14 Italians who were detected to be infected with COVID in Rajasthan. So they were sent to us at Medanta, and nobody had any idea of how to deal with it. But I must say, several things have happened from then to now, that there has been an unprecedented cooperation around the world. There was information sharing, scientific data sharing. When you talked about breaking the genetic code of COVID-19, it went around the world very quickly. So all these things helped to, no matter where they came from, whether it was a private lab or the government information system, wherever it came from, it actually produced a huge amount of camaraderie in this fight, and also consequently led to multiple, you can say, events that saved a lot of lives. So I think that this public-private partnership worked. But at the same time, what I worry about, two things. One is that are we going to shrink back into our silos? My message has been that if you look at the health stack of a country, starting from the primary health, from the ASHA upwards, primary health and partly secondary health is in the domain of the government, which is well organized. There's a network on the ground, there are administrators on the ground, and just to make that, whatever is existing, strengthen it, make it more efficient, which is being done by Ayushman, the Swachh Bharat and the Swasth Bharat schemes. The second part is when it comes to secondary care in tier 2, tier 3 cities, there are private nursing homes available which can be integrated into the local primary health center or community health center and stuff like that. But when it goes, somebody needs beyond that tertiary care is expensive to create. There is a lot of capacity available in the private sector in tertiary care. The government is also building out, but what is the deficiency, I think Dr. Kang pointed out, you cannot manufacture experts overnight. It takes years and years and years. So we should share our capacities wherever they are needed. And like I said, outline being that tertiary care and mid-level care, yes, private sector can participate. The primary health care mostly is in the government domain. So I think what really is, that's one part, but what worries me more is that today, if you talk to any individual, they'll swear by, I want to be healthy, I want to do this, I realize how health is very important. How long that will last, because we have very short memories, and how soon we will go back to our parathas and whatever else we eat, that's what worries me more. So sustained messaging at every level, whether it's private, government, TV, whatever, you're responsible. And I must compliment you that the media really played a huge role in driving it home day and night. I mean, at the risk of getting sick of switching on the TV, but and I know Dr. Kang was always there. I was there a few times. But the point is, where are we going from now? People ask you the next question, and maybe Dr. Kang can answer it better than me. All I know is that nobody knows whether this pandemic or epidemic is over, what's going to happen. Yeah. The only thing is, we should take baby steps towards easing our controls and still be careful for time to come.
Still be very, very careful, of course, like I said, right?
I think that's the message that I can give.
Yeah, like I said in the very beginning, we're all very eager to look at the pandemic in the rearview mirror, but we don't really know when is it catching up. And I mean, we're still in the middle of the pandemic. We do not really know. But when you talk about going back to the silos and the sustained partnership between the private and the public sector, what are the areas really that can really collaborate better so that we have a greater synergy?
So we have our task cut out. Like I said, one of the biggest problems that we have today is that we have acute shortage of doctors, acute shortage of nurses, acute shortage of paramedical personnel. So I'll give you an example. In 2000, that was 12 years ago, McKinsey and CII, I'm the Healthcare Council Chairman, we published a report, Healthcare India, the Road Ahead. In that, we talked about all the 5 pillars that are required to build a healthcare system for a country. Because the infrastructure was the most attractive thing to do for private investment and also government, because it is visible, a lot of money and effort went into creating the infrastructure. So I don't think there is such an acute shortage of infrastructure today. But at the same time, the unsexy stuff of training nurses, and also there are some impediments because the rules are also very cumbersome. I mean, there are some crazy rules which we need to work on. But nobody invested so much in, or responsible people into medical colleges. Private medical colleges were actually made by people who are of borderline respectability, so we don't know what they made it for. But today is the time to really get back into the education system, healthcare system, so that we can support the infrastructure which we have created and we are going to create, because the government is going to, there are already 22 aims. But I was talking to somebody from NITI Aayog yesterday, and they said, yes, it's all there, but we are struggling because we don't have the human capital. So I think that is one of the biggest things that we need to invest in. And collaborations like that have been done between, and my compliments to you, sir, for this wonderful effort that you have made and generous contribution, and John Hopkins, that these are the kind of things that we can actually leverage to elevate the training, the education systems, because John Hopkins is one of the finest medical schools in the world. So we could learn from you. We could collaborate with you and create those schools which will create the doctors of the future.
Absolutely.
Thank you.
Like you said, that there can be institutes, but you do need investment in the human capital. Unless there are good doctors there, what's the point? But Dr. Kang, I have a question for you. You spoke about data sharing and how important it is, and how important is communication really. In any emergency, you know, one of the very important part is that people should be spoken to, they should be made aware of the danger of various aspects of it. So, you know, you worked tremendously in that aspect over the last few years, but can you reflect on the role of this very effective scientific communication to people, to the public?
So I'm an accidental scientific communicator. But I think the reason why I got traction was because I was honest about what I knew and what I did not know. And I didn't make statements about things where there were a lot of assumptions. And I think that comes from training in science, that you state the boundaries of your knowledge, state where there is uncertainty, and as evidence emerges, you add to what you have communicated before. And that, I think, is a function of academic institutions, a function of scientists, that we have a responsibility in times of great uncertainty, which is new illnesses, pandemics, to be able to communicate to people that this is a problem. It's a major problem. We are working on it. This is what we know. This is what we hope to find out. And that's essentially what we've been doing. I also think that there is some need to call out overstatements. And when people project certainty that doesn't exist, it's also important to say
Absolutely.
that is not something that is defined fact already.
We saw it during the first and the second wave of the pandemic. There were statements coming out, there were contradictions happening later. So how important really is that very scientific communication credible information during such health emergencies. Before I move on to some of my colleagues from the media and their questions, we would like to take some questions for you. But Dr. Bhargava, a final question from you. You've written the book on the journey of the vaccine in India. And I would like you to talk a little more about that, going viral, making of Covaxine, the inside story. When you've written that book, but what's India's role in vaccine research and development and manufacturing in the years to come?
Yeah, I think that's a very important question. What is happening? And we have our universal immunization program for the last 6 decades, which was really the backbone for this COVID vaccination. More than 350,000 vaccination centers and 1 million ASHA workers and whatnot, so many doctors. Now, that was repurposed for adult vaccination. And that was working well for the last 6 decades for pediatric vaccination. And then mostly our industry has been manufacturing vaccines in large numbers for most of the world. 60% of the pediatric vaccines are from India. So now the next step and the future that we feel is that India will have to get into the next phase of developing, get into new drug discovery, because yes, a vaccine, we're manufacturing a lot, we're the pharmacy of the world, but we have to get into new drug discovery. And that requires a lot of investment. That is an area that we need to develop, and partnership, both North and South, will be useful for that. And again, on transparent terms, on co-sharing of IP, co-sharing of knowledge, co-sharing of profits, and that is probably the next step for drugs. For vaccines, we again need to get into developing new vaccines, getting in adult vaccines, diseases which are preventable and which are going to be preventable with vaccines. Those are areas where India has to invest a lot in. Mm-hmm. And again, these are things which are requiring a lot of money. Mm-hmm. But as I always constantly talk about frugal innovation, I think that has to be the bottom line, because if you compare Gandhian innovation at one end to Edisonian innovation at the other end, Gandhi's point was there is a thin line between need and greed, while Edison said that anything that doesn't sell, I don't want to invent. So we have to balance somewhere between, in today's world, between Edisonian and Gandhian innovation.
Very interesting. On that note, I would like to take a few questions from my media colleagues here. If anyone has a question, can I please request you to raise your hand, introduce yourself, and then ask the question. I think the mic will be coming to you. You have a question here? Okay.
The questions, I'm Sanjay Agarwal. The questions which have come up is about the data. As Dr. Kang has said, that data has not been shared. Another thing is about the human capital, which Dr. Trehan has said. So how are we going to take these steps? And there's another question for Dr. Balram Bhargava. Co-vaccine was recently, not blacklisted, recently, just two days back. Yeah. They had some issues. So how are we going to, as a country, address all this? And then question for Dr. Gupta there. Sir,
can we go one by one so that we remember the questions and then we move ahead? Dr. Bhargava, would you like to talk about the co-vaccine first?
I think I'll first talk about the human capital part of it, and Dr. Trehan mentioned it. Just want to add on that. Now, what has happened is that traditionally, after the Second World War, the NHS was set up, the NIH was set up. The Bohr committee recommended that a pyramidal health system should be there in India. And they were talking about primary health centers, district hospitals, secondary hospitals, tertiary care centers. Somewhere around the economic independence, when it happened in India, we went wrong somewhere. We glorified super specialty. And while in the NHS system, it's still called subspecialty. So we need good MBBS doctors. And that is where we have, 80s, the GP was a dying facility in the United Kingdom. They immediately innovated. They raised the salaries of GPs more than cardiac surgeons or super specialists. Now, they made the band. So you have to constantly innovate depending on the need of the country in terms of manpower. So today we have 650 medical colleges and nearly about 100,000 undergraduate doctors are passing out every year. Yes, their caliber has to be improved. I think we have to focus on that caliber to be improved. We should not aim to get 280,000 doctors every year as in China. Our patient-doctor ratio is dropped from, or improved from 1 per 1,700 to 1 per 1,300, 1,200, 1,300. WHO recommendation is 1 per 1,000. I do not want it to go in the other direction, the pendulum to swing in the other direction, that we are producing too many doctors. So good MBBS doctors is an area that we need to focus on. Their training and their training in during their internship is absolutely vitally important. Because we have glorified the super specialist in this country, and the UK continues to call them subspecialists. So that is where we have gone wrong.
Okay.
We need to glorify our holistic physician, our poor old family physician, the general practitioner, the MBBS doctor, and that is most important and vitally important. From the co-vaccine point of view, I think these are routine things that happen, the inspections and the facilities, and once the demand had gone down, they are improving their facilities, so I'm told, repurposing many of their facilities, and they have built a state-of-the-art facility in Bangalore, a huge one. So I think those are things which which are routine.
There was another question for Dr. Kang, or? Yeah, anybody else? Okay.
Yeah, I'll address your data question also. I think data question has been a question which has become a perennial question, and I don't think data is going to immediately solve the healthcare problems. It is health infrastructure first, in order of priority, training of manpower, number 2, clean hospitals with good welcoming doctors, and then comes data. We have inverted the pyramid that we are focusing on data. That is, yes, important. And during the pandemic, we had the largest huge data infrastructure where we were able to collate 3 databases talking together, and we were able to give data in terms. We were the second country after USA which had a vaccine tracker, live vaccine tracker, which was demonstrating more than 1 billion population data of testing data as well as the vaccination data. I agree with Gagandeep that the hospitalization data was weak. Yes, but death data has been pretty good, and if you compare it from the Johns Hopkins tracker, that is already, if you look at per million, then India has performed phenomenally well compared to many developed countries in the world. And that is because of the lack of vaccine hesitancy, proper communication from experts like Dr. Gagandeep, where vaccine acceptance was addressed, vaccine hesitancy was addressed, and India having vaccinated more than 98%, 97% first dose and more than 85% second dose in the adult population, I think has helped us tremendously during this, the third wave or the Omicron wave.
Dr. Kang, would you like to add to that? We discussed, the quantity of data, the data on death, the trackers were there, but the kind of data that one would also look at.
So I think the issue with all of public health is data. I'm not talking about health care. I'm talking about public health. If you can't measure a problem, it doesn't exist. And we've had this issue well before the pandemic. So if you take a look at cholera in India, right? We reported, I think in 2016, 4,000 cases of cholera to WHO. One hospital in Calcutta had 20,000 cases of cholera in that hospital the same year. So we have a problem with how we collect data and how we report data. This is not new to the pandemic. And I think from a public health point of view, being able to measure disease is critical because ultimately you want to do intervention so that you can monitor impact. And if you don't have a baseline to work from, you can't measure that impact. So if you take an example of any disease for which we introduce vaccines, Dr. Bhargava is familiar with this, he chairs the NTAGI. Each time we want to introduce a new vaccine, we build a new surveillance system. Today, if I ask you how many cases of influenza there are in the country, we don't know because we are not measuring. And I think this is critical.
Okay, thank you. Is there any other question? Or there's a question over there.
Hi, good evening, everybody. I am Dr. Sohaila Kapoor. That's me. I'm going to sit and talk. I think it's been a really interesting conversation here. But I think one very, critical parameter or point that we somehow miss in this conversation in the word public health are the people themselves. And I think awareness. So, while we, of course, build like infrastructure, build on also like human capital, awareness amongst the, entire public is something which can actually help curtail the pandemic and, many other similar like disasters. So I think better communication, awareness, using, a mobile phone, which has been, I think a technology for, a long time, and actually using the public-private partnership to, encourage organizations which are doing this on the actual ground is, a powerful tool which shouldn't be completely missed. We should not undermine the kind of data, again, to Dr. Gagandeep's point, which can be aggregated from, the people themselves. We should not undermine, I think, point-of-care devices, which are also being, used at home. And I think there is a lot of very, important information, which, if correctly aggregated, cataloged, organized, can make a huge impact. And you can use that whole manpower of, about 1.4 billion Indians to come together to, solve the problem. And I just wanted to say, let's not forget that one word, public, when we talk about public health. Thank you.
All right. Is there any other question that you have? Do you want to?
I think that's why I said Sarkar, Samaj, and Bazaar. So Samaj is very important, and that is important.
Sure. You have a question there. Can we have the mic? And this probably can be the last question. Just a second.
Hello, panelists. I'm Milan from India today. Just a quick question. Learning from the past 2 years of the pandemic, we've done a fantastic vaccination drive. We've been one of the countries that has perhaps seen one of the lowest vaccine hesitancies across the world. To anyone in the panel, is this the right time to move ahead? A lot of people are asking when can they take their third precautionary dose, those below the age of 60 years, and what is your opinion on that?
Any of you would like to comment? Dr. Trehan, would you like to?
All of us want to say the same thing. Yeah, absolutely. 6 months.
We would love to have a different opinion as well.
No, okay.
Dr. Trehan, you go
I'm a
first.
true believer. Every 6 months till this whole thing is on, you need a booster.
Okay, Dr. Kang?
No matter what age you are in, if you're eligible for vaccine, the first 2 doses, I think third should be given.
All right.
I think we don't know enough to be able to recommend vaccines for people below 60 who are healthy at this time. And I think we really need to be doing the research to define the immune responses in people who have been vaccinated with 2 doses and infected, as well as people who have just received 2 doses of vaccine. This is a complicated situation, and we shouldn't be rushing to boost the entire country.
That's a very important and a different point that's coming out there. What would be your opinion on that, Dr. Bhargava? Because she says we need to...
I think I would agree with Amita in terms of it's like a football match. We know where the ball is, but now we need to focus where the ball is going to go. And that is tuberculosis. So let's focus on tuberculosis, and that is very important.
But what about the booster? When she mentions that we do need more research on the impact on the immune system amongst those who've been boosted and those who've been infected, so a lot of research needs to be done in that, and that data probably could be more public.
I think the point that Gagandeep has very well articulated, that we do need more data.
Sure.
And that is why the NTAGI and the government is discussing it, debating it, before we come to a final conclusion.
Absolutely. All right, thank you. Would you like to add to that?
Well, I'm just a big fan of investing in the science. This is evolving knowledge, and we don't have all the answers. And so I'll leave it on that, and some uncertainty of that. Thanks to people like Dr. Bhargava and Terry and Naresh, Trehan, and the sort of research community, we're learning as we're going. And we just have to do a good job of saying when we know something and when we don't.
Absolutely.
And we don't have all the data to say the booster is absolutely necessary, particularly for younger populations.
So sure, so more research definitely is needed in that field, and more credible research, and the results have to come out before we can actually take a call on that. Thank you so much for that. Thank you, all of you, for your time today and answering all our questions. Thanks a lot.
Thank you, panelists. Thank you, Naghma, for moderating today's enlightening conversation. I would like to request the panelists to take their seats. I would like to invite Dr. Sunil Kumar to come to the stage to help felicitate our esteemed speakers. Dr. Balram Bhargava, Dr. Gagandeep Kang,
Dr. Naresh Trehan. And our moderator, Naghma, Sahar.
Thank you again for our panelists and to Naghma for moderating this fantastic discussion today. I would like to invite to the stage to give his vote of thanks Dr. David Peters, Edgar Berman Chair of Department of International Health at the Johns Hopkins Bloomberg School of Public Health and Faculty Co-Chair of Gupta Klinsky Institute.
Thank you, everybody. This has been just a wonderful event and a real honor to be here and a privilege to be giving a vote of thanks. So I want to confess that in my country we don't do a lot of vote of thanks, these formal things. I'm from Canada. And the first time I learned about this, I was a student working in Nigeria. I didn't realize that giving the vote of thanks is a specialty, at least in that country. And just when I thought the conference had ended, the speaker came up to give a vote of thanks. He went around to literally every person in the room, gave their individual accomplishments, their family history, including to me, who I'd never met. He'd never met me. And it went on for well more than an hour. So you will be pleased to learn that I am not a specialist in vote of thanks, and we will be out of here in well less than an hour. So my main job is to thank people. Some of the people in this room have had a major role in actually creating the opportunity for us to be able to come together this way, come together safely and meeting together in person. Now, surely we're in a place where the pandemic is in its long tail. Yes, there may be more recurrences, but we have the confidence to be able to move forward. So after such a long absence of being able to come together, I think we should first be thankful that we can actually do this. This is one of the things to be thankful for. So on behalf of the Johns Hopkins Gupta Klinsky India Institute, I would like to extend my heartfelt gratitude to our esteemed speakers and panelists, Amitabh Kant, Balram Bhargava, Gagandeep Kang, Srinath Reddy, Naresh Trehan, Amita Gupta, Naghma Sahar, and Provost Sunil Kumar, and our MCs Brian Wall, Vidya Mave. I also want to extend thank you to our colleagues at the National Institute of Health and Family Welfare. Many of you are here. We're embarking on an expanded collaboration between NIHFW and JHU on training and systems building, including around nursing leadership. So I'm very pleased about that. I want to also thank Raj Kamla Gupta, as well as Steve Klinsky and Maureen Sherry, for having the faith in us to provide pivotal sponsorship to the GKII. Or for those of you who are in Delhi, it looks a lot like GK2, I know. I also like to give thanks to the Johns Hopkins team in Baltimore and here in India. There's many of you that I should name, but I want to particularly call out Nitisha Besra, who's been working here on the ground in Delhi and really been pivotal, so thank you. I also like to thank Ad Factors, the hotel staff, One Time Travels for really providing different kinds of logistic support for helping us to be here today. But I would like to especially thank all of you for being able to take the time to come here today and help make this event the kind of success and launching that is. So thank you. Let's give a wide applause to ourselves. Now, I want to say that saying thanks is important, but to really demonstrate our gratitude, we need to act. And what the Gupta Klinsky India Institute is giving us is a new opportunity to act together, to do research, education, convening and supporting of practices and policies, and think together with Indian partners along with Johns Hopkins University, we're able to do things to benefit India as well as the world. As we've heard, COVID has taught us how interdependent we all are, and that we must address issues of inequity as a core driver of ill health. We also need to think and act in systems that are interdependent, and we heard a lot of that today. So there is action needed around how we can strengthen India's health system, but every country needs to do this on a continuous basis, and we need to learn together. So just as India learns, we all must all learn. And so research is a really critical place. We've heard of ambitious policies towards universal health coverage, towards health security, some ambitious innovations in financing and other things, being able to now consolidate the financing with the governance, with the quality of care delivery, with the kind of new regulation we need, and new movements towards prevention, promotion, and population health, emergency disaster risk management. These are the new ways that we need to pull together. We don't need to be intimidated that there are so many things, but looking for opportunities to pull them together are really the critical opportunity to move forward and to be able to do so in equitable ways. So I realize I am standing between you and high tea, and where we can partake of the kind of interaction that we've been missing out so much of on the last 2 years. And I'm sure we are all grateful that we're back and being able to do that. So at this time, please let us go forward with gratitude. Thank you.
Thank you once more for joining us today. Please join us in the adjoining room for tea and snacks. We also have copies of Dr. Bhargava's book, Going Viral.